Awesome. Good evening, everyone. Thank you so much for attending the practice match and Privia Medical Group Private Practice and Primary Care, What Residents Should Know webinar. My name is Rainey McNeely. I am the Physician Engagement Specialist here at Practice Match. I've worked here for about a year. If you have submitted your CV for a review or if you attend any of our live career fairs, you'll probably meet me. I just want to remind everyone that tonight's webinar is being recorded. So I will be able to send you the link for this by the end of the week. I do want to remind everyone as well that all of cameras and mics will be muted for all of the attendees. So just remember if you have any questions to put them in the Q&A box, and we'll get those answered by the end of the webinar. Awesome. It looks like we've got some good attendance. Dr. Zia, Dr. West, if you're ready, go ahead.
Hello, I'm Dr. Zia Khan. I'm an internal medicine physician practicing for the past 20 years in Peachtree City, Georgia. I'm also the Chief Medical Officer of Privia Medical Group of Georgia.
And I'm Dr. David West. I'm also an internist. I've been in practice over 35 years in southeastern Virginia near Virginia Beach. I'm a regional medical director in Privia Medical Group in the Mid-Atlantic region.
All right, so for today, we wanted to talk about private practice. I know for me in residency, 20 years ago, private practice was brought up. It was still an option. We had hospitalists were just beginning, and private practice was really the way to go. It's really been the choice of physicians for many years until hospital medicine became so popular. Um, but recently, it just really seems like it is, out of reach. It's not doable. It's overwhelming. And a lot of physicians, young physicians, residents are looking to join hospital employment. David and I, Dr. Weston and I are both here to just change your minds about that. Private practice is thriving. It's alive and well. And with the right partner, we can absolutely succeed.
Yeah, that's absolutely right. I've had interactions with our local training programs here in Eastern Virginia. Often you don't hear the story of private practice. You have more corporate medicine and healthcare entities that are talking with you and maybe directing and sponsoring your programs. But there's a whole nother world out there that we want to let you know about and open your eyes to.
All right, so what makes it such a worthwhile path? When you are working in your own private practice, whether you're an employed physician in a practice that is run by a physician in a private setting, you really have a lot more freedom. You are able to answer to another doctor who actually understands what you are going through. You're not responding really to a hospital CEO, a business person. You're working with a physician that knows the EMR, knows disease states, understands how long it takes to see your patients, understands how timely it can be or how easy it can be. So really working in private practice is very satisfying because you work with somebody that really understands. It also allows you to build great relationships with your patients. I'll tell you in a little bit how I started in private practice, but my mother's patients are now my patients just because we've been able to cultivate those relationships. And, you just build these wonderful relationships with generations of family members. in outpatient family practice, you have a great work-life balance, depending on what EMR you're using, what workflows you have, you're able to really, take some time for yourself, decrease pajama time, as we call it, enjoy more weekends off. Um, so for me, really, my goal is to bring as many young physicians into private practice as possible, because once you start there, it's really, truly addicting.
And I think there's really something to be said for working for yourself and working collaboratively with other physicians. I know the last couple of physicians that have joined our group have been kind of in the corporate medicine realm. They got burned out and didn't like that and joined our practice and have progressed to partnership. And one of the things that they've really emphasize the most is the employees in your practice also work for you. They're not working for a corporation. They're working for you. Their goal is to help your patients in your practice. So there's really no comparison to that. So there's many benefits, and we're going to get into those some more, but that's one of the big ones.
All right, introducing Privia Medical Group. I will tell you a little bit about myself and what Privia is and how I joined Privia. Um, so I finished my residency in New York and a very long time ago, and decided to become a hospitalist because that is the easy path. So finished residency, I got a job, started working for the hospital. And I wasn't an attending. I felt like I continued to be a glorified resident. I kept working uh, for people that wanted me to do X amount of referrals. They wanted me to, they had my schedule laid out for me. They were telling me exactly what to do. So wasn't really, too fulfilled, but, just going through the motions and working as a hospitalist. Then I decided to try outpatient care within the hospital. And even then I started building some relationships, but just the monotony of having my hours laid out for me, really, being told this is what I had to do, having limited time, not really being able to manage my patients the way I wanted to, was very challenging. So for me, I got a phone call from my mom who lived in Georgia and had a practice for 30 years. And she said, I'm looking to retire. Would you consider moving down? So was very nervous, but I did move down, and that was the first time I was exposed to private practice. And boy, it was challenging. So it was myself, my retiring mom. She was still writing on paper charts. So really wanted to look to a partner. I understood very quickly that, even back then, the landscape was difficult, and I needed to find a place that I could work, a partner that I could work with to be successful in the healthcare space. So reached out to a nearby hospital ACO, thinking they would be a good partner and good guidance for me. That didn't work. It just became very cumbersome. The reporting was difficult. There was really no support. In the meanwhile, I got an email from the lead physician of an anchor group that was formed in Georgia for Privia Medical Group. So I spoke with him, and really, I was at my wit's end. I was going to try this, and if it didn't work, I was going to just quit and go back to, getting a job, or I was going to stick it out. Well, here we are now, 10 years later. I went from one doctor. My mom quickly retired when she saw we were moving into Athena and having to do an EMR. She didn't want any part of it. So she retired, but I was able to really focus on patient care. Privia Medical Group was helping me with the business side of medicine, and I was able to thrive. Went from one to two to three, now five doctors, five nurse practitioners, and we're continuing to grow. So that is my story and how I became a part of Privia Medical Group.
So my story is a little different, but we end up at the same place. But so
Yeah.
I've been in practice longer than Dr. Khan. So I've been in practice over about 35 years. came back to where I grew up, joined an established internal medicine practice that's actually now 60 years old. And we're in a local hospital. Our area in Virginia is started at 70,000 people and grew to 200,000 people. So it's a suburban practice with one hospital. We actually did the hospitalist rotation for the hospital. We admitted patients for specialists and primary care folks and everybody. And my path has kind of encompassed the whole spectrum. When I first started, I had a bunch of capitated patients, the first trial of capitated HMOs, and we saw that fail. So we remained independent. We continued to grow. There were independent practice associations, which hospital put together groups of physicians, but they were the ones that were benefiting, and that failed. We actually were approached by venture capitalists, and they were really just about money, and our culture did not really jive with that. So we didn't do that, and that subsequently has failed. We were approached by the hospital to form a physician hospital organization where the physicians in the hospital were supposed to work together to take care of the patients, insulate themselves from competitors, and thrive and kind of start in population health. Well, that also failed and never got off the ground because the models were just bad. So we figured we needed a partner because we wanted to do value-based care. We wanted to maintain our independence for ourselves and our patients because we were a big part of the community then. And so Privia approached us to try to expand in our area, and that was 10 years ago as well. We've been super successful with them. They've helped us with our fee-for-service business, as well as caring for our patients, doing well in value-based care, which you'll hear about a little bit later. But that's allowed us to thrive and continue to be part of the community and stay independent and work for ourselves, which has just been great for us and our patients.
Yeah, and just to add to that, so really to explain what is Privia Medical Group or Privia Health, it is an enablement company which actually helps independent doctors do well in private practice. That's pretty much their mission. They are empowering private doctors to succeed.
And really the importance is allow you to maintain independent.
Yeah.
And they do that. And that's been really the best model out of all those previous things that have not worked for other folks.
So really reflecting on what we both just said, Dr. West comes from a very different, large, well-run practice that was able to align with Privia and succeed. And I came from a one doctor practice struggling, and I sort of, aligned with Privia and I was able to succeed. So it just really speaks to how the model works. The goal is the same, whether you're a 30 doctor practice or a one doc practice. The goal is to adequately do what you see here, have a technology that really works. They have an EMR that we're all on, Athena. They do all our rev cycle management. They help payer contracting, so we get good rates for our contracts. It is pretty much run and governed by physicians. So the difference between this being with a partner and being with a hospital group really is the physicians run themselves. There is such collaboration between the business and the clinical side. Um, and the doctors actually are, I don't want to say telling, but really collaborating with the business folks to, let them know that this is what's important. So, diabetic bundle, which is one of the clinical programs, and how that affects our practices. Coming up with AI tools like Navina is one that we use to help our risk coding. I know, Dr. West, you want to talk about some more, but those are some of the few things that have really helped me be successful as an outpatient private practitioner.
Yeah, Zia. So some of the things that when we joined Privia, we were actually in a good place. I mean, we were a strong group. We were established. We had good contracts, although we were kind of getting squeezed by the competition around us. We'd already been on EMRs. We were doing meaningful use, some things which were good government programs. But when Privia came, they gave us the analytics and all the support and the complicated things that allowed us to do value-based care, in addition to the robust contracting that allowed us to improve the contracts we had. We have some of the best fee-for-service contracts in our area now, based on Privia's clout. It's a large group. We're not the small fish anymore. We're the big fish. And so it really has helped us on multiple levels, and that allows us to really make our staff robust and care for our patients in a whole different way. It streamlined our billing, as Dr. Khan referred to. Um, and the importance that she placed on physician governance just cannot be downplayed. In Privia, physicians at every level are involved in decision making. And it's actual practicing physicians. We do have some administrative career physicians, but most of the people involved, just like Dr. Khan, who's a medical director of several markets, she's a practicing physician. I am as well. The board on the different Privia markets are composed of practicing physicians who have administrative roles and expertise. So with physicians making the decisions, it just cannot be downplayed. It's a great model.
That slide kind of spoke for itself, right? We are Privia is in 15 states now. Um, I'm located in Georgia. Dr. West is in the Mid-Atlantic area. Why primary care? Well, I think, that to me, there's nothing else. Primary care, like I said, the most important part of primary care is the second bullet here, building lasting relationships with patients and families. That is so very powerful. Because in value-based care, when you have good relationships with your patients, you are able to drive great outcomes, decrease risk, and do well for your patients, and have a huge impact on healthcare. Um, you know, as I talked about earlier, I have some patients that were patients of my mother. And when we talk about diabetes, we talk about hypertension and the importance of control, importance of taking their medications, they listen. Compare that with, you know, uh, a hospital run practice where there's no relationship built, the patients feel like they're a number, and really don't feel uh, like a part of something big. So for me, primary care really focuses on the just lasting relationships and the impact the doctors really have on our patients.
Yeah, absolutely. We did a lot of inpatient medicine, and as things progressed and you had the hospitalist movement, it kind of changed the nature of our practice. We used to do everything. We did nursing homes, we did house calls. And when it came down to the end of the day, we had to decide what was best for our patients. And we decided from a business standpoint to concentrate on outpatient, primary care, internal medicine. It was a little bit of disruption, but that's really been the slide says, building relationships. The trust that you build also cannot be understated. I mean, that's really the key of taking care of patients, that they trust you, their families trust you. You see multiple generations, whether you're in family medicine or internal medicine. So, primary care, I think, is certainly the way to go. And your patients are tired of being bounced around in hospital systems where I can't tell you how many people have come to us and they say, well, look, you've been here 30 years. Every time we go back to our other office, it's a new physician or a new APP. So that continuity, when you're working for yourself, you're in private practice, is appreciated by patients. It's best for them.
All right, so value-based care and population health. These are very popular nowadays. And I think one of the reasons why private practice is thriving again. Um, Value-based care, I'm sure you've heard that by 2030, most um, patients will be in some type of ACO and dealing with some sort of practice that is focusing on value-based care. It's really based on outcomes. So accurate documentation, efficient care delivery equals shared savings. And this is what allows private practice outpatient physicians to have high earnings and do very well financially, as opposed to just a fee for service model where the more patients you saw, the better you did. It didn't matter whether, physicians were so rushed seeing patients that somehow we lost our focus on health sometimes. But value-based care really allows us to go back, take a deep breath, see our patients for longer, focus really on A1Cs, hypertensions, making sure they're getting their screenings. Prevention is key. Um, this value-based care, I believe, is now sort of the buzzword and future of medicine.
Yeah, and I'd go so far to say that it's not just future, it's the present. All organizations that are trying to move to do better in value-based care and population health. And we've just at Privia, we've been ahead of the curve. I mean, we've been very successful for a number of years, and that message is spreading. The other thing, when you look at the population health end, it says that, it begins and ends with quality. So you're focusing your whole office to take the best care of that patient you can, and it's best accomplished with a team. And that team is you design the team. And actually, we've done some projects in our office. We've allowed the folks that are boots on the ground to design their workflow to accomplish value-based care. In our office, the medical assistants who work with the individual physicians and providers, they've designed the workflow to get it done. And so we just concentrate on taking care of that patient, and it helps with documentation. And that's just that team approach that you're pulling together because they are working with you, not for some other entity. So it really helps the patient. It takes a lot of burden off of you as well when you get tuned up like that.
And I feel the patient feels that too. They realize that they have a whole team behind them working, say a diabetic, working to make sure their eye exams are done, A1Cs are where they need to be, their blood pressure is controlled, making sure they're taking their medications. It's just an overall fantastic way of treating patients that really involves the patient education, discussion, and it's been successful for doctors now.
And the note there with patient engagement, deeper engagement with a smaller patient panel. So the patients are engaged in their health. You're trying to support them, and you're not just running trying to rack up the RVUs, the relative value units that a lot of employers measure your outcomes and measure how much you're going to receive in remuneration. So it's really more about the patient, not about how many folks you crank through at level of complexity.
All right, so this is a very exciting program, the Privia Prime program that was started. We are finishing up soon our first pilot. It is a paid part-time virtual weekly virtual program with some in-person opportunities if the care center or the practice is within your geographic area. It is during your residency, so currently the next cohort will start in July for third-year residents, and it will last for 1 year. It's a two-phase program. Phase one will be value-based care, and the residents learn with weekly virtual lectures from Privia physicians and non-physician leaders, learning about risk and value-based care, and really getting focused on what value-based care is all about. The second part of it is really about medical practice, how to run a medical practice, understanding billing, rev cycle management, what it really takes to be a private independent physician. At the end of the first phase, the residents receive an LOI, letter of intent for possible, hiring into the medical practice. So by the second half of the third year, hopefully, early in the second half, offers are given out, and it's an opportunity to join Privia Medical Group private practice offices. Currently, we have opportunities in Georgia, the Mid-Atlantic, and Texas.
I would just say this is just a fantastic program. We've looked at how to engage and get our message out to physicians in training. One thing, and when you own your practice, you're also a small business person. So you own a business, you're responsible for your employees, and we treat them as family. But the things that you learn in this program, you're definitely not getting in your training programs at all. And a lot of your professors, unless you have clinical faculty, are really not up to speed on that either if you're in an academic center. So this is the nuts and bolts. And when you finish this, you're going to understand more than most people in practice right now. I can tell you that. So it's a great opportunity.
And I think that's all Dr. West and I have this evening, but would love to answer anybody's questions, or if you have any comments, we're here to chat.
Perfect. Thank you. We did have a couple questions come in. The first says, I'm sorry, this might be a silly question, but could you give an example of value-based care compared to fee for service?
Sure. Do you want to take that, Dr. West?
Sure. So fee for service is the way that's been out there for a long time, and it still is a big part of medicine. So when a patient comes to your office, you perform a service for them. You see them, say, for an office visit. You do the appropriate documentation, and you put in a billing code based on what you do. And there's a lot of criteria on that. So you're putting in a bill that patient's insurer is paying you for what service you provide during that one visit. Value-based care is kind of more all-encompassing. So with value-based care, you are trying to perform the best quality as you can for patients. There are a lot of metrics that go into determining what that quality is, and you're taking care of a whole population of patients that are what's called attributed to you. So those patients are kind of stuck to you medically, and you're responsible for their care. So if those patients have good care, and they have high quality care. There's a lot of measures of that, like Dr. Kahns referred to the diabetic bundle, where how well their A1Cs are, how much their kidney function is monitored, how well their blood pressure is controlled. Those metrics for your whole population are how you're reimbursed. And so it's really taking care of the population. By doing good care, you actually are cost efficient. So you save money based on the budget that's allowed for the patient. There are other things that go into establishing that budget, but basically you give good care, you save funds, and you share in those funds. So that's how you're remunerated. So it's a different way that you're paid. So you hop in anything I did not say or was not
Yeah,
clear on.
that was a great explanation. So pretty much fee for service is the more patients you see, the more money you make. Value-based care is you can make a whole lot of money doing the right thing by the patient. So, when you say diabetes, if you show the payer that you're doing a good job taking good care of that patient by, if it's a diabetic, the A1C is below 8, blood pressure is below 140 over 90, they have, they're getting their eye exam done, they're taking their medications, their kidneys, you're looking at their GFRs every year. that's good. That means you're doing great by that patient and you will share in the savings that you have saved. Now, what we've seen is patients that are uncontrolled, patients whose A1Cs are worse, actually are very costly. They go to the ER more, they get admitted more, and they're a huge cost to healthcare. So by empowering outpatient physicians to take care of those patients, we are saving healthcare a lot of money.
Okay, our next question is what's your average number of patients per day?
So I think it depends per physician. Um, I like to see anywhere from 18 to 20 patients a day. I have some in my practice who have a very sick panel. Um, they like to see 15 patients a day. So I think it all depends on what your focus is. Dr. West?
Yeah, I think that's right. Yeah, we have some variability as well. I mean, I'm a internist who's been in practice a long time, and you'll find that your patients age with you, and so they get
Yes.
more complicated as they go along. But yeah, I generally see about 20 patients a day, but it really depends on what they're there for. A quick visit is a 15-minute visit, a physical is a 30-minute visit, a new patient's a 45-minute visit. We've structured our office so we have kind of walk-in hours where our APPs see the minor illnesses. So I'm not trying to cram 10 people in my full schedule. So it really is, I go at the rate that I'm comfortable with, that I can deliver good care to the patients and they feel, seen and heard and that they're taken care of. So I guess the answer is it depends, but it's a reasonable rate for physicians. And the value-based care end of it allows us to see fewer patients because we've been very successful at Privia where we've been remunerated well for what we've done because we've done a good job for the patients and the insurer.
Perfect. That plays into our next question of are physicians working 5 days per week? Is there after hours APP coverage or are the doctors responsible? Are you using AI within EHR like DAX Copilot?
Wow, great questions. So the first question I believe was, are we, can you repeat that first question? I've lost my
Yeah,
train of
no,
thought.
you're fine. Are physicians working 5 days per week?
5 days
And
a
is
week.
there APP coverage after hours?
Yes. So it depends. I have some physicians within the practice that work 4 days a week, some work 3 days a week. I'm currently working 2.5 days a week. It just all depends. I think the beauty of private practice is how you want to practice. Now, again, I work 2.5 days a week, but my patient population is probably very complex. I have another colleague that likes to concentrate on younger patients and wants to see have that type of practice. So I think, when you're running your own practice, you're able to make those decisions. We do have after hour coverage. And APPs do take call, but I also take call. But our call really is very minimal. And it is because of our EMR. We have portal messaging, and we also have structured our patients and our calls in such a way that patients are able to send messages that are captured by RNs and triaged and taken care of. So when I'm on call, sometimes I don't even realize that I'm on call. I don't get any phone calls. But most of it gets taken care of during the workday. The second question, how are we using AI? That's a fantastic question. And AI now is everywhere. I think our rev cycle management uses a lot of AI. We have a tool now within Athena that I mentioned earlier called Navina, which helps us. It helps us identify high-risk patients, so we can improve outcomes, and that is an AI tool. Privia has also created an AI tool for us called Privia Engage, which allows us to, as my clinical manager put it, it's a one-stop shop for efficient data collection to bring patients in. So, annual wellness is a big deal for our patients, right? Annual wellness visits. So this is a report with one button. You can stratify based on appointments, based on, when the last one was done. Another part of it is looking at open care gaps that you can pull one report very quickly to address open care gaps. So these are just a few ways that we're using AI. I know AI Scribe is a big deal now. My practice is not using it. I'm not sure, Dr. West, how you want to comment.
No, we're not using AI Scribe right now. We're using the other tools, Navina, to help us identify those patients and things. But I just want to go back to the first part of the question, like how many days a week we're working. This is the beauty of the Privia model. Every practice can do what they want to do. And like in our practice, what we tell people is we generally start at 4.5 days. Once you become a partner, you work 4 days a week, but you can work more or less depending on what you want to do. When I had 2 kids in college and getting ready to pay for a wedding, I worked a little more. But you can work as much as you want to. What I tell my associates when they're coming on to the partnership realm, I don't care if you work 1 day a week, as long as you break even and it doesn't create any more work for me. So that is kind of it's you can do whatever you want to do. As far as the call, I mean, part of outpatient medicine, the call is always reasonable. Um, we used to get, I don't know, tons of calls when we were doing inpatient medicine, but outpatient, there'll be weekends, they'll get 2 or 3 calls. We don't have our APPs take call. That's one advantage for them, but we don't have any evening hours or weekend hours. And so the call burden is very light. So, but again, you can create your lifestyle the way you want to, and you can schedule your clinic hours the way you want to. So that's one of the good things about our model.
Perfect. The next question is, when joining Privia Health, obviously we get a lot of benefits as stated here. How is Privia Health compensated?
So Privia is each market is made up of independent practices. So we are not employees of Privia Health or Privia Medical Group. We each own our own practices. So Dr. West runs his practice. I have my own practice. In Georgia, we have over 100 practices that are each owned by a physician. So that's the beauty of Privia, is that it allows you to be your own boss, run your own practice. Privia helps us take care of our patients by, providing an EMR for us, helping us with the business of medicine. So, we are a small practice. We see our patients, we bill insurance, we do value-based care, and we get bonuses at the end of the year. That is how we get paid. Dr. West?
Yeah, I think that the Privia package, they do take a certain percentage of your receipts, which includes kind of your electronic medical record. There's a whole lot, at least in the Mid-Atlantic market, but it's really reasonable. We actually looked on our own, and the whole percentage that Privia takes to run the practice and do the billing and do the EMR was less than we could get the Athena EMR by itself. So it was a no-brainer for us. They also share in our shared savings, although the majority of the shared savings do go to the physicians, which you won't find anywhere else for sure. That's one of the things in other entities that are taking that are doing value-based care. The physicians are probably not as compensated percentage-wise as well as we are.
This question says, how does Privia Health help a new grad start his or her own practice from scratch?
Wow, that's very exciting. Yeah, Privia absolutely I can help, a new grad start their own practice. I would love to have a one-to-one discussion if you're interested. I'll display my email, or there's residents at priviahealth.com. You can email and we can have a discussion. I think different markets have different ways that they can help graduates here in Georgia. We can do a market analysis and really identify areas that are available for, that are ready and ripe for a new independent practice to go up. They will also help market. They give you a website. They um, set you up with Athena. Um, and also help you with the business side of things. But yeah, this conversation can be very long and we can definitely talk specifics for sure.
Our next question is, can you kindly explain when is the Privia Health Prime program for the residents starting? If it starts in July of 2026 with PGY3, can a resident who is now a PGY2 currently apply for it so as to attend in 2026?
That's absolutely right. So now is the time to start applying. We will be sharing the application link. So probably the second half of the second year is when we start accepting applications. So right now, I think is a time to start thinking about it. We're advertising Privia Prime. You were trying to get interest in Privia Prime, but application links, I believe, will go out later in the next couple of months, definitely by January 1st. So everyone on here, I think we have everybody's emails, so we can send out application links for sure.
Perfect. It looks like so far that's all of our questions. Does anybody else have any questions? You can post them in the Q&A chat box so we can get those answered tonight. All right. Well, if no one has any more questions, thank you all so much for joining us tonight. And thank you, Dr. Khan and Dr. West, for your presentation on Privia Health. Like I stated earlier, this webinar was being recorded, so I'll go ahead and send that recording link to everyone by the end of the week. If you have any questions, please make sure you reach out to the residents at priviahealth.com. And if you have any, um, if you want to go on to practicematch.com, you can check out all of our free career resources. We also have a list of all of our free career fairs that we have for the rest of the year. Thank you, everyone. Thank you, Dr. Khan, Dr. West. Thank you for having us tonight.
Thank you.
Yeah, you're welcome. Thank you. Good luck, everyone.
Thanks, everyone. Have a great night.
Bye-bye.